Hello, my name is Sheila Ryan, and I'm a professor at the University of Nebraska College of Nursing, and also a member of the GEDI board. My presentation today is a review of some principles of globalization that will help you gain support, permission, access, or resources from any leadership, financial officers, or board members you may need to get support for your international programs. We're all very aware of the globalization of our society today, and that it increases demands on all of us to understand differing perspectives, traditions, religions, politics, cultures, even health behaviors and health systems. We are all aware that the world is becoming smaller, that the community we live in is a global community. So global partnerships, be it in nursing or in education or in healthcare, need to develop with some principles of dialogue, collaboration, and shared planning. When that has occurred and there's a relationship of trust to establish some shared needs and some shared abilities, then it's important to identify the purposes for which such a program can benefit, such as reducing international nursing shortage. There are a couple of countries in the world that have 1.5 billion people who are constantly looking for extra jobs for its people. They could be a resource in nursing with better educational access. It's also true that many countries in the world are developing their healthcare systems to be more westernized with technology and advanced specialization, seeking opportunities to do cardiac surgery, oncology, bone marrow transplants. But the nursing itself is still stuck in a passive role of needing permission to do patient care and is not familiar with making specialized decision-making on behalf of patients. And certainly the preparation of leadership is a hallmark of the United States, in at least beginning to think that leadership for all emerging healthcare roles is a skill and an attribute and a content area that nursing in the United States has excelled at for some time. One of my best definitions to help other people understand globalization, why should we invest someplace else, is this slide. Microbes do not know borders. They don't know languages. They don't know different monies. They don't care about religions. They are mutable and ubiquitous across the world. With increasing transportation, with increasing international businesses, it's very common for us to be exposed to microbes we haven't had exposure to in the past, or other diseases, or other amoebic dysenteries. It's one thing to go to another country and be concerned about their current illnesses and what we might be able to do to help them better treat these illnesses, but also to recognize that with emerging infectious diseases, microbes can span the globe rather quickly. This slide is just an example of, I think, the beginning of this decade, the number of microbial emerged infectious diseases in a variety of locales. I like to emphasize that our learners, whatever environment we're in, whether they're staff, professionals, faculty, or students, that globalization is a process that is changing the nature of our human interaction across wide-ranging spheres, including economic, political, social, technological, and environmental. And because of this very thing, what we thought globalization was about economic markets is now becoming an interwoven integration of all these aspects. We can't even deal with health without being concerned about the economic, political, and social, technological, and environmental aspects of the culture or country we're in. Again, globalization is in its simplest form and in its most profound effect without borders, boundaries, and less isolation. If you think about that, we need to begin to strategize for global programs that do away with some of the borders that we even know and surround ourselves with here in our own country, such as certification, licensure, those nice boundaries that keep my discipline separate from yours. With globalization, even those boundaries will be lessened. And as Yates says, globalization is about reducing the ignorance of the whole. Students today are yearning for these opportunities, and they're seeking. A very frequent question of recruiters into colleges is how much international opportunities are available to me, regardless of my major. Global health needs is another way to approach the resource aspect of the global programs. The patients, the systems. In my travels throughout the world, I think that the top 3 would be an improvement in all countries in the world. If we could improve sharing our management and leadership skills, all health systems would benefit. Infectious disease control is what the World Health Organization say is a primary concern. And we're not talking just about AIDS, but any new emerging diseases. SARS, amoebic dysentery is an infectious disease. And maternal and infant health. Reducing mortality of maternal infants throughout the world is a priority of WHO. Now, in addition, you'd want to localize your description of your program and the benefits of your international programs to your home boards or officials by saying that trauma care or public health and clean water or life expectancy are specific aspects highly required or necessary or demanded or requested by the visiting country as their priorities that we can help with. If you have a school of public health, for example, and a public health emergency in the country you're visiting, that may be a logical approach. And global health systems need, no matter where you are, limited and uneven access with diverse conditions and limited resources. This is a skill set for health system leaders, frankly, to learn this skill. We have some opportunities of teaching that from bioterrorism, emergency triage in our own country, but it's a continued demand on health systems worldwide. Throughout the world, it may surprise people, there are too many doctors and not enough nurses. And I also would like to add not enough nurses of the skill and knowledge content set that is appropriate for where they need to expand their health care. And a lot of it is doctors have been educated in a lot of countries with very little nursing education. It's more on-the-job training, and doctors do not know how to take care of patients. So you can't advance medicine without bringing nursing along. Every country I visited in could benefit by more community and home-based services as more and more countries are concerned with primary care and better treatment of chronic care management and health promotion strategies, which occur in the home. Systems also realize that no matter what technology or advancements occur, it needs to be supported with strong educational foundations, data, information, and service systems. The World Bank recommends that all countries in all health systems of the world need to focus on these 5 parameters. And I think our own system could benefit from this as well. Greater emphasis on primary care, resulting in decreased hospitalizations. Improving the quality of health personnel, which is a strong motivator for our international partnerships. And a focus on effectiveness, outcomes, and costs. And lastly, improving the healthcare management of the systems. We've learned from a lot of studies in the world that the determinants of health don't rely on hospital beds or numbers of physicians. They do rely on education, employment and income, safety and health environments, housing, nutrition, and access to information and health services. So the foundations of building a society are built around these determinants of health. But an avenue of entry is usually treating the illness and the problems that exist when we go in. And I like to say in conclusion, any place in the world is accessible where there's an internet line. And here is an example of a solar panel that's feeding a satellite download that's driving a laptop. So I wish you success in building and supporting the support and strength of your international programs. Thank you.